Good morning. I hope everyone is doing well. My name is Riley Stith, and I'm the marketing director for the Beverly Hills territory for Doctors on Liens. Welcome to Doctors on Liens' second webinar. Like everyone else, we are respecting the shelter-in-place order, and we decided that this was the best way for you to meet our doctors. And we also wanted to remind you that we are open for business, and we want to continue to inform you about how we are handling cases at this time. So let's get started. Our first panelist this morning is Dr. Kenny Hanna, board-certified orthopedic surgeon from Pledge Medical with offices in Newport Beach, Bakersfield, Long Beach, Riverside, and as soon as this shelter-in-place order is lifted, Las Vegas. Thank you so much for joining us, Dr. Hanna.
Good morning, thank you.
And our next panelist is Dr. Richard Sage, a chiropractor, founder of Smart Spine Institute and Surgery Center in Arcadia since 1985, a multi-specialty clinic and surgery center with an orthopedic surgeon, pain management, podiatrist, chiropractors, and physical therapists all on staff. Thank you so much for joining us, Dr. Sage.
Good morning, O'Reilly, and thank you for having me.
Absolutely. And our first attorney for this panel is Mike Alder, owner of Alder Law and Zapanta Alder Law. Mike is the former CALA president. He is the youngest lawyer to be named CALA Trial Lawyer of the Year. He was the 2014 California Lawyer State Bar PI Lawyer of the Year, and 2019's Century City Bar Trial Lawyer of the Year. Thank you so much for joining us this morning, Mike.
Thank you.
Absolutely. And finally, we are very excited to announce Will Truman, senior partner at the law firm of Doucette and Stein. Will, I believe he should be joining us.
Hi. What? Sorry, is this Monday Men's Macrame? This looks...
Oh, no. This is the Doctors on Liens webinar that we do every Monday at 11.
Oh no! Oh, thanks, you guys. No, I'm fine. I feel fine. I feel good. But I'm really trying to catch up here. I'm not actually a lawyer anymore. Here's the honest truth. I never was. I was just pretending. But anyway, I got a lot of stuff to catch up on. So hey, you guys have fun with your lawing and your doctoring. I'll find it. Sorry to interrupt.
Amazing. Thank you so much for joining us, Eric. So that obviously was not Will Truman. That's Eric McCormick, who played Will Truman on Will and Grace. So we just wanted to have a little bit of fun this morning during this stressful time. Thank you so much, Eric. You were so kind to play along with us. So now let's get back to the real fun. Med Legal Today, Ask the Experts. We have a plethora of questions. Feel free to send any you have in the chat or the Q&A section, and let's go ahead and get started. So Mike, the first question is for you. How quickly do you expect normalcy to resume in the personal injury world once the stay-at-home order is lifted? And do you see the major stumbling block along the way?
That depends. If the stay-home is lifted in mid-May, and people go back on the roads and go back out, then there's going to be a lull of a couple of months. Everybody is experiencing a pretty significant downturn in numbers. But if it's longer than that, we're going to have a problem of a lull of several months of cases not coming in. I'm experiencing, like everybody else, we are moving all of our current cases. And that is because defense lawyers and adjusters want to work. And insurance companies have reserves on especially smaller cases that they want to get out. Can you guys hear me?
Poorly.
Yeah, if you could come a little bit closer to the mic.
Sure. Is that better?
Yeah.
All right. And so the insurance companies want to settle cases that they can settle to get their reserves out. The defense lawyers and adjusters want to keep their jobs, so they're working on that. And so the big problem is trial dates. And for cases they get, the trial dates are getting moved back substantially. Ultimately, trial dates make the world go around. So especially on disputed liability or larger cases, we're not going to get a trial date on a case that's not preferable 5-year because criminal cases, preference cases, 5-year cases are going to push our trial dates out probably till next year. And so when you talk about normalcy, in terms of trial dates, probably not till next year. And the biggest problem is if you're litigating, you got to fund those cases. You got to fund those cases and let them sit now for 6, 7, 8, 9 more months. And that's going to be a issue that's going to affect normalcy.
Mm. So what elements of our industry do you think may never resume for better or for worse? For example, now that Zoom has become so prevalent, will there be a need for court reporters or conventions?
Well, I believe that as we're seeing the benefits of remote, everybody's doing it, but that doesn't mean that personal interaction becomes less important. I think it's actually highlighted. Now, we're going to do depositions remotely, but you're going to need a court reporter. I mean, the law is you have to have a certified court reporter. So until that law changes, and you get through the lobbies and you get through all that change in the law, we're going to have court reporters. And it's actually a good thing to have court reporters. The only thing that's changed is we've relaxed either stipulation or just because we're doing it, that we don't have to have a court reporter in the same room and that kind of stuff. But that's never going to change. We're going to need court reporters. In terms of a convention, I would say the next convention will be the best attended convention ever because everybody wants to go to Vegas. Everybody wants to see people in person. So I think that in terms of conventions, once we get a little bit of time and people feel comfortable, it's going to be huge. I know I'm going.
Yeah, exactly. Let's move on to our doctors for a moment. Dr. Hannah, as an orthopedic surgeon, how are you able to document treatment without being hands-on due to COVID-19?
Good question. So what we're using is Zoom. We're using the Zoom platform, and not just generic Zoom, but we've actually upgraded very recently to Zoom Healthcare.
Okay.
Zoom Healthcare provides for patients really the confidence that we can perform these consultations without infringing on their privacy. So Zoom Healthcare, the benefits of Zoom Healthcare is that it's really HIPAA compliant. Zoom doesn't store any of the information from patients, medical records, or the things that they're consulted on. So there's virtually no issues there. And all the information is encrypted. So Zoom Healthcare has afforded us the ability to provide that security to patients. And I think that's a great thing. So in terms of the documentation, it's all done via Zoom.
Wow. Wow. And I would say, how are you handling then your new client patient signups? What do you do when a person isn't technologically savvy?
Yeah, so we have staff here that's very well versed on sort of from an IT standpoint on the software. So they're able to help patients even before the Zoom consultation. So to make sure that we sort of get them on board and get them educated and sort of talk about the intricacies of how to do the Zoom consultation. And so that hasn't really been an issue for us because we have sort of very competent personnel. The vast majority, obviously, the Zoom consultations from our standpoints are all subjective. It's what the patient tells us, what the patient describes. They tell us their pain level on a scale of 1 to 10. They can tell us their functionality, is their range of motion, has it been affected? They can also tell us sort of to what degree these ailments have sort of coincided with their activities of daily living and their work duties or their hobbies. And so that subjective portion is very, very helpful to us. Now, obviously, we can't get much of an objective because that requires a formal physical exam that we will be, and we clearly denote that in our notes that that formal physical exam is going to be put off to a later point when the patient can see us in the office and have that done to confirm our diagnosis. And we talk about how that no treatments or interventions are performed prior to that completion of that formal physical exam. So the consultations is merely from a subjective standpoint. which gives us a lot of great information. It sort of can help us sort of guide what sort of their next, the progression of their treatment, whether it be recommending a diagnostic study of sorts, a CT scan or an MRI, or a referral to somewhere where they can get the needed care that they need. And then that objective portion. So that's sort of how, from an orthopedic standpoint, we're using it.
Wow, okay. And for you, Dr. Sage, what platform are you using and how are you handling new client patient signups?
So we're also using Zoom, and some patients prefer to do FaceTime. But what I'm finding out with Zoom and the FaceTime, we have a scheduled appointment for the patient. If the patient doesn't call within the 10-minute time frame, we call the patient. So our turnaround's much better. We usually you'll get cancellations or late patients, and timing's always off with your schedule. But it's so much better because we retain so much better. So if we have 10 patients to call that day, we'll get 9 out of 10. So it really works well in that category. And then of course telemedicine is great and we're using it the best we can. But when they come into the office, most of the stuff that we have is all online. They can download it from their home and email their registration papers, or when they come to the office, they can register on the computer if they don't want to deal with people.
Amazing. Dr. Sage, quick question then. How is massage therapy, how is massage therapy, how does it work during this time, since it's most likely not allowed with the social distancing? Are there any at-home treatments that you're recommending in its place?
Oh, definitely. Yeah, sure. And so our massage therapists are all licensed therapists, but they're not working right now. So what we have them doing is doing some soft tissue work prior to treatment with the chiropractor. So they'll get some hands-on massage work. Some of your classic massage work, it's minimized. So the patients have most of their clothes on. If anything, they may have their shirt off, but we're using gloves. As you can see, everyone's got a mask. And so, and when patients come in, we do a temperature check. And of course, we ask them if anybody in the family has been sick. So we do those precautions. They do get some massage work, and we use a multitude of modalities. We have a Faragon, which is a great gun. It really loosens up the muscles. Some people just prefer the Faragon. It's a great substitute for hands-on massage. In fact, when I get some work done on me, I prefer the Faragon on my whole body, and that takes a while. And it's a good supplement. I tell patients the best thing for them at home is usually the foam roller. I really like the foam roller, and I've trained most of them on how to do it. And then I have a video I send them that walks them through, because most of the time it's their back. You get in a car accident, what's it going to be? Your neck, shoulders, lower back. And that's really easy on the foam roller. And then the other things that are easy, like the T-band, the thighs. So it's not that hard, and people really enjoy that type of thing. One other thing I want to add too is the patients that are afraid to come in, they come at the crack of dawn. So they're the first ones in at 9 a.m. And my facility is really large, so we hold about 40 patients in a waiting room. So if we get 10, it's not a big deal. They're all far apart from each other. But man, the 9 o'clock hour, it's busy.
Wow. I'd love to hear that. Mike, I have a question for you. We actually asked this last week, and we would love to know your thoughts. How will insurance companies react to telemedicine and gaps in treatment due to COVID-19?
Well, gap in treatment is a dirty word, that's what I'm just reading. Got a mediation on Wednesday. Just got involved in the case this morning.
Yeah.
Look at the defense report, and gap in treatment is like the center thing. I hired this doctor to look for nothing but treatment. So what we're seeing is, at this point, it remains to be seen whether they question the efficacy of telemedicine, if they try to discount it. But what we can't do is not do it for fear that it's not as effective or not as well respected. You know what? I would love to be a trial lawyer arguing against the defense lawyer saying, oh, well, they only did it by video. And I get to explain that they were in such pain that they did it by video, but they couldn't go outside. That's even worse. So the key is that you treat, that you do whatever. If Zoom doesn't work, go to FaceTime. I'm seeing HIPAA compliant is great, but if they're not sophisticated and you can't do it quite HIPAA compliant, do it anyway. And I don't think it's going to be a huge deal that people are going to, the insurance carriers are going to argue that, oh, you only treated by telemedicine. That's much better than not treating.
If I could add on that, Riley, we see the same problem, and all my doctors, there's 4 chiros and therapists, everybody in here, we document clearly patient denied to come in due to COVID. Okay, number one. Number two, we will have those telemedicines and say, okay, we saw them on a weekly basis, nothing's changed, they don't want to come in again because of COVID. I've actually had patients come in with gloves, hat, glasses, the whole thing, and they said that I'm just here to tell the doctor I'm still hurting. Okay, I don't know how to use the FaceTime and all that other stuff. They'll just come in and tell you, I'm in pain, nothing's changed, I'm taking the medication, and we document, and then when we submit our report, there's your gap in treatment. You want this person to die, or do you want this person just to have a gap in treatment?
Let me just say, the point is that if you have a patient or a client that is making a decision, then that's because they're in pain or they have a problem. The problems with gap in coverage or treatment is they say, well, you didn't have any problems, so you didn't even think about it for 9 months, 10 months. If you have a note that says, I really want to come in, but I'm not going to come in because I'm afraid of COVID, they're thinking about it. That is not a gap in treatment. That is someone who's having a problem and it's noted, and that's good enough.
Interesting. Dr. Hannah, this question is for you. I'm getting it in the chat. I usually like to wait to the end to do some chat questions, but it keeps coming up. What do you do when a patient needs a translator? What are the pros and cons of our new normal? Maybe if you could elaborate on how you guys are handling that at Pledge.
Yeah, so in our office, we're actually very, very fortunate to have translators in our office.
Amazing.
Of course, we're practicing, CDC guidelines for the proper distancing and those precautions. So in our office, we have bilingual staff who is able to communicate pretty well with our patients overall.
Amazing, amazing. And Dr. Sage, are you seeing any uptick in business due to all the reckless driving we're hearing about, and given all this beautiful weather that we're finally getting, no more rain? Do you anticipate an uptick over the next few weeks in business?
I really do anticipate a huge uptick. So when this first started in late March, my patient flow was down 80%.
Wow.
Yeah, it was huge. And I had to furlough 8 employees, and that's very difficult. I've been in business for 35 years. We don't do that. But what I've noticed is in the last few weeks, especially last week, it's definitely climbing back up. And I'd say we're down maybe 50%, some days less than that. A question was asked, what's a Faragon? So this is what a Faragon looks like. It's a therapy gun, and it's pretty amazing. If you haven't seen it on Instagram or Facebook or one of those social medias. So I'm going to turn it on. It's a little bit loud, but you can see it really gets into the muscle. It's very powerful, so it has different speeds. And patients love having the Faragon. There's a couple different other brands, but the Faragon is one I stand by. It was made by a chiropractor, Dr. Jason Wersland, and he's all over the sports world. So we do a lot of sports medicine, and the NBA, the NFL, MLB, they all have Faragons on the sidelines. And so it's a therapeutic device, and we use it, and it's very effective.
Amazing. And for you, Dr. Hannah, do you anticipate an uptick in business? What has been your experience in the last few months?
Yeah, we actually had a very, very busy month. And I do expect an uptick. The vast majority of our consultations come from referrals from chiropractors, physical therapists, maybe pain management. So I expect as they get this sort of uptick of increased volume, that will sort of generate and flow to us as well.
And Mike, do you believe lien negotiations will be lowballed due to an increased desire to settle during this time?
Probably not now, because I'm seeing in my practice what I'm hearing from most people, friends of mine. We're settling cases kind of like we were before, not the big stuff, the 7-8 figure cases. They're a year away, but the smaller cases and in between are settling because the people who are on the other side, the lawyers and the adjusters, want to work. And there are reserves, but that they need to get back if they can settle the case. But I think if this goes another 1, 2, 3 months and the unemployment continues, you're going to see at least, let's go to mediation, and then they throw out kind of a low number and they bite. And so what we're trying to do is we want to go to mediation, of course, but beware sometimes if they won't give you any specifics, they may be trying to do some psychological warfare on your client by getting him into a mediation, throwing out, they're like, oh my God, I'm going to settle my case and pay my rent. And then they lowball them at the mediation and they're like deflated. So you got to be careful and try to push for more specific. Hey, I'll go to mediation, but I need to get a number before I'll go. I mean, you just got to try to gauge it.
That's so interesting. I do want to move over to the Q&A section because we have a ton of questions here. The first one is for the doctors. Now that you have been, this is from Sophie, now that you have been practicing telemedicine for a few weeks, how is it effective? Dr. Hannah, let's start with you. How effective has telemedicine, been for you during this time?
Yeah, so it's been quite effective. I think first and foremost, I've seen a higher number of compliance. The fact that individuals can have the opportunity to have their consultation via video at sort of any time during the day means they don't have to drive, or if they're mobilized, they don't have to worry about that being an issue. So for whatever reason, it makes it much easier for those telemedicine consultations to happen. So compliance is definitely much higher. The other thing is I've noticed patients are very comfortable using telemedicine. It just seems, from my standpoint, when I'm performing these telemedicine consultations, they just seem more relaxed, more comfortable. They're able to describe their symptoms. And we know that, when patients are on their way to doctor's offices, have these appointments, it's probably a stressful time for these patients. So many of them some of them don't want to always come because of that initial presentation into an office. So I think the telemedicine has afforded them the opportunity to not have those stressors or not have those frustrations potentially. So that's, that makes for a more comfortable situation for a patient. And if they're more comfortable, they're more apt to talk freely and be more compliant in terms of being present for that consultation. So it's been nice that way. Because there's not waiting. They're not waiting in the waiting room for long periods of time. There's less frustrations that way. So I think for my and from a staffing standpoint, that's not as much of an issue either. And so it's been very effective for us to be able to get these consultations in and performed in a very timely manner according to patient schedules, and not having sort of those delays that a lot of times we hear about. And it becomes something that's negated with telemedicine. So overall, it's been very, very effective.
Wow. And Dr. Sage, did you want to touch on that? How effective has telemedicine been for you during this time in the last few weeks?
Well, it's a definitely added bonus. That's how we really look at it. Right. Because our office hours are the same as they've always been, pretty much 9 to 7, Monday through Friday, and on Saturday by appointment. So it's about half day on Saturday. So we're here most of the day, which allows people a lot of time. So we have enough staff to keep it open and enough flow to keep it open. And then we set time aside for do the telemedicine. And it's maybe less than 10% of my patients are doing that want telemedicine. Wow. Sometimes you get a new patient that wants it, but our in-house ortho and pain management doctors, and we also do pain management. Our surgical center is still open. We're still performing our procedures for pain management. So those doctors really benefit from the telemedicine more than the chiropractors do.
Mike, this question is for you in the chat from Dr. Rabbani. Is the statute of limitation going to be extended?
It already has.
Yeah,
they did it. I forget exactly the timing, but they extended not only the statute of limitations but also there's called a 5-year rule, which means that once you file, you have to be in trial in 5 years. And that has also been, so yeah, I mean, I think Orange County, I think Ventura County is not accepting filings at all. Most of the courts in LA, Orange, Ventura, um, you know, they said civil jury trials are halted for X number of months, and then we'll see. So I mean, you know, the problem is those were your hammers. When you said, I'm not going to do it, you go in with a hammer, and that hammer's gone.
Interesting. Yeah, Dr. Hannah, I have a question here for you. It says that the governor lifted the hold on surgery. Can you talk a little bit about that?
Yeah, so very recently, elective surgeries have been prior to this point. Elective surgeries were sort of prohibited. Now that they've been lifted, that essentially means we now have the ability to perform these procedures that have been on hold. Now, we're still practicing, you know, these safe guidelines in terms of who is or who should be given an opportunity to have an operation. So for us, we followed what the California Orthopedic Association has put out, and they have some really strict, so they have some guidelines and recommendations on who should be looked at closely in terms of having a surgical procedure. And those are patients who have had acute injuries. So individuals who have an acute fracture, i.e. a broken bone, individuals who have torn tendons, individuals who have suffered nerve injuries or dislocations. Those are injuries that require prompt attention by a surgeon. And those, if left untreated, you know, we know that the ramifications of those can lead to sort of chronic pain and permanent injuries. And so those, by the California Orthopedic Association, have been deemed sort of more important in terms of addressing them sooner than later. Some of the other the other procedures that may be on hold at this point that are going to stay on hold are those types of injuries that surgery has been recommended. However, they can continue sort of with some of the physical therapy modalities or chiropractic modalities in anticipation of their surgery at a time point when it's, you know, clear and safe. So those acute injuries that are more like the fractures that I mentioned and the tendon injuries, those are the ones where we're getting in sooner than later, and leaving some of the other ones for a later time point.
Interesting. Dr. Sage, have you had to turn away a patient or client due to COVID-19?
Unfortunately, we have, and yeah, because when they come in, we do a real brief assessment. How are you feeling? Any symptoms? And then we do the temperature check.
Okay, great.
And you know, the cutoff is 100, so you're supposed to be 98.6. If you're at 99, it's questionable. 99, you know, but you know, there could be walking. Their blood pressure could be high just coming from the car, what have you. But man, they're upset. They came through the trouble of coming there, and we just can't take that chance. In my facility, we have 6 or 7 private rooms, and then we have a group room. And we've been able to utilize all the private rooms and prep them. And so the chances of any kind of contact with someone else are really minimal. But by the same token, I have a staff, and the staff needs to stay clean too. So
Absolutely.
unfortunate, but yes.
Mike, this question is for you. Should we anticipate that the trial set for 2021, May, June, will be moved to a later date, given the current trials that are being pushed back?
Probably not that far. Probably, I mean, there's so many factors. And I love when people say, when I go and the judge gives me a trial date and I go, accept, and they go, Judge, I got 6 trials set on that day. I'm like, dude, 5 of them are going away. So between now and 2021, there's a lot that can go on that can lead it. You know, the issue is going to be your trial in August. Probably not going to go. Probably going to get to the end of the year, beginning of next year.
We have a couple questions here for you, Mike. How are mediations going to be affected if clients are not in the room for negotiations? Are they postponing the mediations too?
You know, that's a bigger discussion too. I'm happy to talk about that later when we're at the end of this. We'll tell you how, but the whole point is that you got to do what you can do. Whatever your caseload is, you got to push it in every way you can. And so the other side, I can't, I won't, no, I got to be there in person. And we don't know what's going to happen in the future. So we got to make that mediation as easy as possible. So when they say no, you turn your hearing aid down, you can't even hear it. You say, yes, we can. Here's the Zoom site. Here are the mediators. Here's what Fusion ADR, whatever is saying, signature is saying. Look how easy it is. Let's do it. Let's do it. Let's do it. Same with depositions. Same with everything. And I'm like, you know what? You miss 100% of the shots you don't take. You just got to do it on every case. Some happen, some won't. You just got to keep pushing.
For sure, for sure. Dr. Sage, as a chiropractor, when you do telemedicine, this question is very interesting. They're saying that when you're teaching patients different self-care treatments, is that documented as an actual visit with charges or just noted?
There's a code for that, depending on what you do. So sometimes there's just giving patient instructions. So that's a treatment. So you can, it's not a hands-on treatment. There's different codes for different things that you're going to do. And then there's a code for an exam. If you're going to basically do a consult, find their subjective complaints and try to do some objective findings on their ranges of motion, that's a different code. So that would be like a real brief exam. It's a 99211 code. And then if you do actually, hey, you do the foam roller, do it like this, here's some bands, do it like such and such. And there's a specific code for those type of treatments, like a therapeutic exercise code and so on.
Interesting. Dr. Hannah, on the news today, it was mentioned that they were talking about quarantine fatigue. Not sure if you've heard of that term yet, but if so, would that be used as a diagnosis eventually? Do you know? It's a question in the chat.
Yeah. I suppose from a sort of a mental standpoint, that can be. We know that a lot of people are frustrated these days for multiple reasons because of being quarantined, whether or not they can get out to get exercise, their work being affected, they're not working, not able to travel to see family. So there's a multitude of reasons of why now, because of this national emergencies and the stay-at-home restrictions, why people would have this sort of quarantine, psychological or mental effect. I think Mike wants to chime in a little bit on that too.
Oh, please.
No, well, I was just going to follow up on something that was said, and I just didn't want to forget it. I know that you guys, the doctors, for sure, you're not reducing or you're charging less. You're not charging less for telemedicine. And I would say that that's a huge mistake for a lawyer to ask that the charges go down if someone heard this. Because there was a question earlier, are the carriers going to discount telemedicine? And if you charge less for that telemedicine, you're just telling the other side that you don't believe that it's the same quality of medicine. And so I've heard, well, isn't this a good time to get a good deal on your medical treatment? Like, this is the worst time to get a good deal on your medical treatment. Don't do that, because you're like, it's penny wise and pound foolish. You're telling the other side, yeah, this is not as good as the original. Do not do that.
If I may, I think that's a great point, Mike. Just to one additional point on that, for me as a physician, I still take the same responsibility. I'm still accountable, and I'm still taking the same liability. Arguably, I may be taking more liability than previous. And so I don't think that the billing should be any different. And here's the other point. I always bill according to what justifies what I do anyway. So, and that hasn't changed. So I think for a multitude of reasons, the billing for me stays the same.
Interesting. Dr. Sage, What is the price of the Theragun, and is it available to the general public?
Oh, it's definitely available to the general public. Here's the gun again. You can see it. So, and it changes positions.
Oh, interesting.
Yeah, so different angles. So the Faragon, it's the top of the line. It's the Rolls Royce of all the guns.
Okay.
It'll last. You can't get this thing to shut off. Again, there's about 40 other guns that are copycats, but this is, again, Dr. Jason Wersland, a chiropractor, developed this thing, and this is the one that all the pros are using. So there's different levels. The pro level is $600, and then it drops down to, I think, 400 and 300, depending on if you get multiple speeds. These heads come off. So there's different attachments that go along with it. So it varies. If you go on, you can go to Theragun.com, or you can go to Amazon. If you click on Amazon and punch in massage gun, get ready. You're going to get bombarded with a lot of different guns that pop up, and they're good. But again, in our office, because we have 4 different chiros and therapists that are all working on patients, we put these things through the mill. So I've tried other guns, they didn't last, so I recommend the Faragon.
And is that the brand name of it?
Yes, Faragon. Like therapy gun, Faragon.
Theragun. That's the brand name. Amazon. There we go. Theragun.com. In the chat, it was written. So for those of you who are interested in looking, Mike, this question is for you. If restrictions are lifted on the 15th, do they expect to be fully staffed again or still on skeleton crews? Could you talk a little bit about that? This has been the Q&A.
You mean the law firms, are we going to be fully?
I'm assuming the restrictions for the stay-at-home order, if they're lifted on the 15th, do you feel that the firms will be fully staffed, or will you guys be on a skeleton crew?
I don't think there'll be a shortage of people who want to come into the office.
Yeah.
You know, what I did was I had 40 people work at home, and one person went 2 days a week to get mail, and one person went 3 days a week to get mail and scan it. And that was it. And that's been that since for a month. You know, we are going to start doing a little bit at a time, adding people. But again, it's all, if you got a fever, if you're not feeling well, if you're not, you can have thermometers at the office. I mean, we're not doctors, but, you know, giving free rein, if you don't feel good, don't come in. And, but it actually, from a mental health standpoint, a lot of people want to come in, they want to interact. When I did my firm Zoom every Monday, I mean, people are literally crying because they haven't seen people, and they're like so happy to see them. And so, you know, I expect that a big number of people are going to want to come in, even if I tell them not to.
It's very interesting. While we're on that, Mike, this other question is for you. What do you do with discovery delays by defense, specifically using this pandemic to delay the case and not provide discovery for months?
So I can talk about that fully on Friday and we'll talk about it at the end of this thing. But look, now is the time. You don't wait for the other side to ask you stuff. There are 5, 6 things that the other side needs to evaluate your case. They need the doctor's records and bills, all of them. They need the relevant ones separately in addition to all of them. They need statements or depots. They need photos of your client before and after. They need form logs. They need the police report and the property damage. Why the hell do you need the other side to ask you for something you already know they need? Now is the time to look at every goddamn case you have and send it to them. And not a big stack of paper, very easily digestible things. And so I get that you want discovery from the other side, but I'd say probably 80% or more of my cases, I don't need any discovery from the other side. It's them that need information from me. They got the money. I got the info. Okay, the info. I want the money. It's pretty simple. It's an adversarial system with a collaborative process. So right now, go through every case. You already know what they want, and get it and give it to them. That is better that's light years better than waiting for them to do something.
Great. Well, we have one last question in the chat that I want to ask the doctors. Would UV lighting, Dr. Hannah, we'll start with you. Would UV lighting be a good investment for clinics for you guys?
I'm sorry, can you repeat that question? I think your mic was in and out.
Would UV lighting be a good investment for clinics?
You know, that's a great question. There isn't any evidence at this point that I've seen or that's been talked about sort of in the medical literature that would support that being an effective measure or an effective tool. So if we don't have the evidence behind it, I don't think at this point we're going to implement that. In fact, some of that may actually have more harmful effects than benefits. And so at the end of the day, just like what we do with any procedure or treatment option that we prescribe, we're always weighing the risks and benefits of it. And so at this point, and we practice evidence-based medicine, right? And at this point, since there isn't any definitive literature defending it or promoting it, we're not at a point where we're implementing that at this point.
Amazing. Okay. And Dr. Sage, did you want to touch on that? Whether UV lighting would be a good investment for clinics, for your practice?
I agree with Dr. Hannah, evidence-based, but it just recently been on TV that they're talking about the UV rays will kill a majority of the bacteria and viruses, which, I mean, we live in sunny Southern California. You know, most of the times it's already sunny. It's kind of hard to say that you can do that. But Riley, I wanted to touch real quickly on something you brought up earlier about quarantine, using that for diagnosis. So, I often put anxiety as part of my diagnosis list for people who've been injured. And so the quarantine is going to exacerbate the already pre-existing anxiety from the accident, from not getting better, from going through the trials and tribulations of getting therapy and trying to get better, whatever your condition may be. So I don't know if there's a diagnosis code we can use for that. I'm going to have to research that, but it definitely exacerbates the anxiety issues.
Okay. Interesting. Mike, we have one last question. I just got some in the chat. If I could just hold you guys for a little bit longer. We have a question about gaps here. If the client has gaps in treatment and not due to COVID per se, is there anything we can do to minimize the bad impact upon the case? And then I'm going to go into the doctors with one more question. So Mike, could you answer that?
Well, no, I mean, with any kind of gap in coverage, you got to come up with the reason why there's a gap in coverage, and it can't be, well, I wasn't hurting. I mean, that's the whole thing, right? The problem with the gap in coverage or treatment is because it's assumed that there's a gap because they weren't in any distress. And so if you have family issues or other issues that can explain it, you know, it doesn't have to be COVID, but you got to have some reason why they're not treating. That's why I'm saying even a quick check-in shows they're thinking about it and it's an issue for them.
Wow, okay. Dr. Hannah, how do you argue with an insurance company that does not accept one ortho visit due to during the ortho visit? The patient stated that his insomnia was not because of the accident. The patient told the chiro that he was feeling much better, but the chiro still referred to them as an ortho. I think they need to elaborate a little bit on this question, but it's for you, I guess. How would you argue with the insurance company that does not accept one ortho visit?
Well, you know, that's an interesting question. I think that perspective is better argued or expanded upon by the attorney.
Call me on Friday.
Yeah. There we go. On Friday.
Right?
Yes.
On the gap in treatment, not because of COVID, but there may be some COVID circumstances, like the doctor's office hours didn't allow for that, or no one could take me because they were sick with COVID and I don't want to be in the car with them. So there's some other issues COVID related that can be, because like Mike said, you can't have a gap in treatment because I didn't feel like going that day. Then obviously you don't hurt and you don't deserve a settlement. But you know, there's extenuating circumstances that don't allow you to. Please be explicit. Tell the doctor that, hey, these are the things that why I can't come in on these days. my wife's working, or my wife has COVID and I have to nurse her. And so he can document that. I document all those things. When I submit my report, every file is copied, right, Mike? They're all copied, all right? And they're gonna see doctor's notes. And if the doctor wrote in there, you know, this patient didn't have a ride because his wife had COVID and he can't drive, or he's afraid to drive, or he, you know, whatever the issue is. So it could be COVID related.
I love that, Dr. Sage, because Mike, we had a question here saying, are you recommending clients to keep daily journals, diaries, in response to their pain, limitations, effects on ADL, vocational issues, etc.? Is that a recommendation that you're sharing with your clients?
It can be a sword and a shield. If you start it, you better keep doing it, because when you stop, it will be used as the marker for when you no longer have any more problems.
Right.
You start it, you got to keep doing it.
Love that. Love that. Well, we'll get to the last question, Dr. Hannah. They're just pouring on in. Are you holding steroid injections due to concern for impairing the immune system?
Yeah, so that's a great question. We know that cortisone injections decrease the immune response. So like everything else, we sort of have to weigh the risks and benefits. For me, I would hold off on performing any cortisone injections until I've sort of exhausted the other measures of treatment options. It would be whether it's chiropractic or physical therapy or some sort of modality that doesn't involve a cortisone that would decrease the immune response. If at some point where things go along and they've just sort of plateaued in their physical therapy or the chiropractic therapy, and they're still having discomfort, we know now that chronic pain can decrease the immune response. We have to weigh the risks and benefits as to whether a cortisone injection would be beneficial at that point. If it's been chronic and it's been a period of time and they're still having pain, then it may be warranted at that point, after weighing the risks and benefits, to perform a cortisone injection. However, I will say that if that is performed, if it's decided to perform that steroid injection, then we have to be very specific with sort of the aftercare instructions. And what that means is letting patients know that your immune response will be suppressed to a certain degree. And so we highly recommend at least several days of quarantine, isolation, maybe up to a couple of weeks even.
Wow.
And those are sort of the way I would handle that.
Okay,
Weighing
great.
the risks and benefits, chronic pain, and then sort of those aftercare instructions should an individual elect to have a pain-relieving cortisone injection.
Great. Yes, please, Dr. Sage.
So Riley, we do a lot of pain management in my facility. And so there are other injections, medications you could put in there to help subside the pain or be a diagnostic injection. So we're performing some spinal procedures, like what's called a facet block. So the joint injections just basically numb the area and try to identify certain areas and radio frequency. So there's certain pain management procedures that we are doing.
Okay.
But we are not doing is the epidural, because you do use a steroid. But I was informed on May 6th that the Pain Management Association is going to allow the steroid injections again. And that's pretty much the only time that we do steroid injections is on the epidural. Most of the time when it comes to extremities, we do the PRP, which is the platelet-rich plasma, and that's a lot more beneficial on the extremities.
Wow, wow.
I will make, Ray, if I may, I think
Yes,
that's a great
please.
point. Yeah, Ray, you mentioned the PRP, and that's a great discussion point. So PRP is platelet-rich plasma, and that's where we take a patient's own blood, we spin it down, and we collect out just the platelets, and we inject them into various areas where there's ailments. And we found that those treatment modalities actually help significantly to relieve pain, help with muscle spasms, and such. The nice thing about these platelet-rich plasma injections is that we've found that they do not compromise or suppress the immune response, especially when they're not done under anesthesia. They actually help enhance the immune response. So nowadays, if I'm able to assess a patient and come up with a treatment modality that would include a platelet-rich plasma injection, then I will offer that above before a cortisone injection for the reasons that I've just mentioned.
Great, great. Wow, this was so informative. So before we wrap up, Dr. Sage, I would love for you to go over your office hours, just so for those who are listening, they'll know what days you're open, et cetera. And then Dr. Hannah, I would love for you to go in your office hours as well. So Dr. Sage, let's start with you.
Sure. It's Monday through Friday,
Perfect.
9 a.m. to 7 p.m. We take a break between 1 and 2.
Great,
And on Saturday from 8 a.m. to 12 noon.
great, great. And Dr. Hannah, your
Yeah,
office
so
hours.
We're open regular hours. We're open on Saturdays by appointment only, and the vast majority of it is just like this, where I'm sitting here and conducting these telemedicine consultations. So we're open in all of our offices, and we're available.
Great. Is there anything else that you guys would like to add that I did not mention before, Mike? I do want to go over your weekly webinar on Fridays, but is there anything else that the doctors you want to add to this webinar?
So one more thing.
Yes, please.
So we use a program called Solution Reach. So it sends a text to the patient to remind them about their appointment, whether it's for the office to come in for chiropractic care or whatever, or for their telemedicine. So they'll receive a text, and on the text, if they need to change the appointment, they can do it via the text.
Great.
So I'm not promoting Solution Reach, but that's the one that we use, and it works really well.
Awesome. Awesome. Love that. Mike, we know you have a weekly webinar on Fridays. Do you want to share a little bit of information about that to those who are listening?
Yeah, so, I have a personal injury firm, Alder Law. I also now have a workers' comp firm, Zapata Alder Law, and through the PI firm, Alder Law, I started doing an Alder Talk series where I put out 30 seconds, a minute, 2 minutes of advice, and I would get questions, a lot of questions. And so now every Friday at 10 a.m., if you go onto the Alder Law website, click on Alder Talk, we'll send you a Zoom link, and it's open season. I mean, I've been talking about how we've been dealing with our practice, how to help deal with what's going on, from getting a PPP loan to how to do 998s to how to open policies. But it's really an opportunity for younger lawyers, especially, to just ask me whatever the hell you want. I've kind of been through it all, and I'm happy to help. So every Friday at 10 a.m., if you go on my website, Alder Law, hit at the top, Alder Talk, put in your email, we send you a link, and it looks like I'm gonna have to upgrade my Zoom to whatever premium it is. But that's a small price to pay for people listening to my ass, so I'm all right.
Absolutely. Absolutely. Well, I do want to thank all of our speakers for taking the time to talk to us today, this afternoon. We have everyone's contact information, so we can send you answers to any questions received by the chat directly. Let me also remind you that most of our offices are open and are seeing patients and practicing telemedicine. In addition, our pharmacy, Brightside Specialty Pharmacy, is open and doing deliveries statewide. We also would like to thank our webinar partners, Expert MRI, USA Express Legal and Investigative Services, Pledge Medical, and Brightside Specialty Pharmacy for partnering with us today. And just as a reminder, make sure you follow us on Instagram and Facebook, and also tune in to our Instagram Live on Wednesdays. This week, we will be going live at 1 p.m. to do our walkthrough with our doctors, where we take you through a quick tour of their office. So once again, we look forward to seeing you next Monday. Thank you so much again for your time, and I hope you have a wonderful rest of the week.
Thank you.
Thank you.
Thank you.